So you might be wondering, how can physical therapy take place in my home? So maybe you've been to outpatient physical therapy in the past in a gym setting or a clinic with a lot of equipment, weights, different tools that the therapists have at hand, and you're wondering how an effective course of care can take place in your home. So one of the first things as a home health therapist that I assess is a patient's goals, and then we also get a baseline. So if someone is at a fairly low level of ability, such as needing assistance to sit to stand from a chair, then going to that outpatient clinic environment is going to be very fatiguing, very difficult for them to get there and have enough energy to really participate in some of those clinic activities. So that's one thing, is partly it's our population that we're seeing at home, but also it's our skills and creativity and things that we can bring along with us. So some of the ways that I challenge patients in the home is by using equipment they have. If they have a bike or a little QB elliptical, or some of the little hand weights or other gym equipment that they have, we can assess that and then add it to our care plan as it becomes appropriate. And that can be a fun way to integrate the patient back to an exercise routine that they can perform in their own home. The other thing is equipment that we bring with us. So my bag, or my car, I have a balance pad that's kind of a dense foam. We call it an Airex pad. That's really an easy, lightweight thing I can bring in and out of people's homes and use that to progress balance difficulty. We have TheraBands. That's a pretty popular therapy item and something that can easily be left with the patient, so they can have it for their own use in between sessions and after discharge. I also have a kettlebell and a few dumbbells. I have actually little dumbbells that go from 2 pounds to 5 pounds with just one set of dumbbells. So that's really nice for my car and being able to progress patients with one set of dumbbells instead of having a 2 pound, a 3 pound, a 4 pound, a 5 pound set. Also challenging people with body weight exercises. So whether that's a sit to stand and maybe starting from a high chair with arm support to go up and down, progressing it to taking away a pillow or having them sit on a lower surface in their house, progressing how much use of their arms they're using, whether that's a 2-hand push-up, progressing to a 1-hand push-up, progressing to holding a weight. So even the same exercise can really be added onto to increase the difficulty level. The other thing is just creativity, seeing what's around the home. There's many times where I've used grocery bags or kitchen items that can be, a few pounds of weight and something that they can easily grab and use. There's even using the counter for balance exercises or countertop push-ups to be able to progress the difficulty. So some of that creativity, body weight exercises, knowing how to position patients to make things more difficult. And then the other thing is considering getting outside. I'm in Oregon, so rain is definitely a big factor for when we can go out and do things in the community level. And that's another nice tool as you get closer to discharge, if possible, is being able to get out and walk longer distances, uneven surfaces, navigating crossing the road, which can tell us a lot about safety awareness and balance, and managing an assistive device out in a community environment kind of helps us know about that discharge readiness. And then the other thing to consider is maybe we are working towards a discharge to an outpatient clinic. Possibly that patient has had a cardiac event and really would benefit from some of the cardiac equipment and tools that they could use to get a longer sustained session. Or maybe there is some certain resistance exercises that we're hoping that they can perform with higher weights or different tools. The other thing to consider is aquatic therapy. So I've had patients with like chronic pain, fibromyalgia, things like that when I worked in outpatient and had a pool in the clinic, I saw a lot of good results with that. So possibly we get them to a point where leaving the house is feasible and then discharge onto that next level of care in the community to a specific resource or service that they need. So those are different ways that home health therapists can modify exercises, use the things that are already in the home, bring some pieces of equipment with them, and be creative and hopefully get outside if the weather permits.